So what we're going to start with is, what is perimenopause? So perimenopause is basically just a transitional period between your years of fertility and before you hit menopause. So menopause is after you've gone an entire year without having a period, that day is menopause. And then after that day, you're postmenopausal. So perimenopause is simply just a transition. I know our society tries to shame people and make women feel like this is a shameful topic, or we know that pharmaceutical companies and conventional medicine wants to make perimenopause a disease, but it is not a disease. Perimenopause is simply a natural transition that occurs in a woman's life. It can start as early as the mid-30s all the way to 50s. So anytime within that range. And again, it could start earlier or later, depending on if women have other conditions like PCOS or endometriosis, or if they've had cancer treatment and they're forced into menopause. If you have questions about how to treat it or should you treat it, you should follow up with your primary care physician. If your physician is not listening to you, or they're saying that you can't be in perimenopause, you should find a healthcare provider that will listen to you and will take you seriously. So if you'd like to learn more about perimenopause, go ahead, like this video, subscribe to the channel, and you can also join me for my upcoming 5-day protein challenge for perimenopausal women.